Hello everyone, my name is Lieke van der Brekel and I'm a medical doctor and a PhD student at the Utrecht University Medical Center. During medical training, we spend a lot of time on how to recognize a symptom. Sometimes this is not so hard, for example, severe abdominal pain is not easy to hide. But what if a patient with cancer is admitted to the hospital and one of their symptoms is anxiety? Have a look at this. As a child, you may have made these scary shadow figures on the wall. And the good thing about it is that they were not real. Anxiety in patients with cancer is real, and the prevalence is up to 40%. So I would like you to take a moment and think about how to recognize anxiety in your patient. As you may have experienced, this cannot be seen from the outside, so you should really make more effort to get to know what is going on in someone's mind. Insight in the predictive symptoms of anxiety might help to recognize this anxiety sooner and more often. Therefore, I would like to present to you the rationale, methods, and results of a cross-sectional diagnostic study into anxiety in hospitalized cancer patients. One of the definitions of anxiety is that it is a biological response to threats to the safety of an individual. Feelings of anxiety can serve as well, like an alarm or siren. It makes us alert about potential dangers and also ready to fight or flight. That's all very good news, right? Well, not if anxiety persists. Its impact on quality of life is huge. Anxiety is very understandable when diagnosed with cancer, but literature shows that it is underestimated, under-recognized, and inadequately assessed in patients with cancer. The prevalence of anxiety ranges from 12 to 30 or even 40% in patients with cancer, but the exact prevalence we don't know. So therefore we have formulated our first research question: what is the exact prevalence of anxiety in hospitalized cancer patients? In order to improve the recognition of anxiety, insight in the predictors could be helpful. Therefore, our second research question is: what are predictive factors for anxiety in hospitalized cancer patients? We aim to stratify the outcomes for different stages of disease, and we compared our results from our study in the hospital to an in-hospice study. So how exactly did we assess anxiety? We did not really collect the data ourselves, because in the UMC Utrecht a symptom diary is offered daily to all cancer patients that are admitted to the hospital. This gave us a unique access to a lot of data, which is great news for us. The Utrecht Symptom Diary is a 12-item questionnaire to assess the most common symptoms in cancer patients. So patients score their symptoms on a scale from 0 to 10, wherein 0 stands for no symptom at all, and 10 for the worst conceivable symptom. Anxiety is one of the symptoms that was scored in this diary, as well as the potential predictors of anxiety, such as dyspnea or depressed mood. So we collected data from all patients with cancer that were admitted to the hospital between 2015 and 2018. And we also collected data on the Z stage, death status at time of analysis, which was 3 years later, and information about medication. We also had access to previously collected data from a hospice, so that we could compare the outcomes. Using all this data, we've conducted a cross-sectional analysis, and the chi-square test was used to compare the prevalence of anxiety between the 3 different phases of disease that we stratified for. And also, we could compare using this chi-square test between the hospital and the hospice. As you may expect, we've conducted a linear regression model to identify predictors for anxiety. Now let's take a closer look at the flowchart. The orange boxes are the groups that we have analyzed. And as you can see, our total group consisted of 2,144 hospitalized cancer patients. It was only possible to stratify part of this group into 3 disease stages, which resulted in a group receiving curative chemotherapy, a group receiving palliative chemotherapy, and a group receiving symptom-directed palliation only. Now, for the baseline characteristics, I would like to point out 3 of the most important baseline characteristics. So we slightly had more male patients in our sample. 58% of all patients were male. The mean age of our sample was 60 years old, and in the total group, 42% of patients had died at time of analysis. Now let's have a closer look at the stratified groups, because we found that when disease progresses, age increased and also more people died. The prevalence of anxiety in our total sample was 22%, which is really high compared to previous literature. We found varying prevalences over the stages of disease. And comparing our sample of patients in the hospital to patients in a hospice, we found a much higher prevalence of anxiety in the hospital. As you can read from the p-values resulting from the chi-square test, these differences were statistically significant. Now, I will walk you through the table with predictors of anxiety. On the left, we can see that female sex, a lower age, insomnia, dyspnea, and depressed mood were predictive of anxiety. Depressed mood was by far the strongest predictor, as you can tell from the second column with beta coefficients. A 1-point increase in depressed mood predicts a 0.66 increase in anxiety, which is a very strong correlation. Well, the last column shows the confidence intervals, which might be interesting if you're really into scientific research. If you're not, just ignore it. These were our main results. So to conclude, let's think about our patient from the beginning. Would you have known if your patient felt anxious? Considering the high prevalence of anxiety we found, we should be more alert of anxiety in our patients with cancer, especially when disease progresses. Depressed mood was the strongest predictor of anxiety in our study, followed by female gender. So, when your patient shows signs of depression, and especially women, ask your patient about anxiety, so that proper treatment can be provided. Thank you for your attention.